pledge allegiance to the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Is there a motion to approve the agenda as distributed?
So moved.
Second.
All those in favor say aye.
Aye.
Okay, we will move to the COVID-19 related action items. I would like to do just a couple of things, and then I'd like to call on Dr. Gorman. We have been exchanging articles pro and con, and also discussing the reporting aspect of the health department and whether the standard in Kansas is right or wrong, according to some published articles, and she is going to help me go through that. The first thing that I would like to say is this is not simply a physical health problem for the commission. This is, from my viewpoint anyhow, a four-part problem. And the first one is physical health, and a lot depends on physical health. The second part is the behavioral health, and this is having an impact on behavioral health, globally, nationally, statewide. And we already were struggling where people before COVID, and I visited all of the behavioral health people in South Central Kansas, and it was a problem, and we don't have a way to address it as adequately from a state standpoint. And then this is throwing it even into a worse situation, and we don't have capacity for what some of the lack of hope is causing in some of our people in South Central Kansas. The third thing is economic vitality. If we don't have a remedy that allows our people to get to their jobs, to allow our small business to stay open, and for people to feel comfortable going into them, we have a problem. And so we have to look at economic vitality. And the last piece is community unity. Now, that is the hardest one, because people have strong feelings either way. And so no matter what you do, there is a group that will not accept the solution. But I just wanted to put that out there, that this is more than that what we see all the time in the news. It is a four-headed monster. And somehow we have to keep everything going and address all four of them. I'd like to put up the Harvard deal.
Have it in that item there. But you can click on it if you'd like to see it too.
Okay, well, anyway, I don't know. I'll just say this. The last 5 days we've been in the yellow. We are finally up the way the reporting works, and the results that we look at today are based on Monday. Monday, the 21 cases that were sent out late afternoon by the health department are not going to be in there on the cutoff. So we are at 321 instead of 342. But that lag has been what we've had all along. and the last 5 days have been in the yellow. The daily 7-day moving average through 321 cases has been moving down from our high in the orange of 5.7 down to today was 1.14. And the new cases per 100,000 is 4 on that basis there. So we are moving down really low in this. I don't expect, if I understand the way they use this and report the data, for that to get out of the yellow on even with the 21 in there. But we will have to wait to see. Are you able? Okay, I'll wait just a second.
Commissioners, you can see that too if you click on the agenda item, and anybody in the public can also see that as well.
Okay. The other piece that I wanted out there, and it may not be on what you put out, was Mike Wagner is updating the 60-day, and I wanted to show the 60-day that's not on here.
I can move it over there real quick. Did you update it as of today, or?
It's updated as of Monday. The one we showed before was as of Friday. Anyway, it continues to show that compared to the other surrounding counties, we are doing quite well. And the hard part in evaluating this is that Reno County has had a mask ordinance, and they have not ever taken it down. And last week, they were the 3rd fastest growing COVID hotspot in the nation. Ellsworth County is similar in the red zone, and they're quite high, but I don't have the detail on them, but I am guessing it is because of the prison. And we know in prisons we have a lot of incident, and it's hard to separate out, so we have that problem there. Harvey County went into red for a short time and are back out, but they're still in the orange and higher than we are. They have had a mask ordinance, and they extended their mask ordinance. Sedgwick County has been doing a ton of testing and have now the ability to do 4,500 through Wichita State University, and so they are doing their part. Still my understanding, Dr. Gorman can say if it is different, but we are testing basically people that have symptoms or people that have come in contact with somebody that have symptoms. We are not doing the general public like Sedgwick County, where you can just drive up and if you want to know, you can get tests. We are not doing that. So the latest we jumped with 21 cases. We had 441 tests, and that meant our positivity of 62 cases over that 14-day period was 14.05, which is the highest that we've been. But once again, we're only testing people we think may have a good chance of having that. So with that, I'd like to call on Dr. Gorman. She has a lot of information that she can give us.
Thank you so much for letting me come, and thank you for sending me the articles that you've had questions about, and I appreciate the opportunity to look and answer questions as they come up.
If you want to drop your mask to talk, it will be
Safe
okay,
enough.
if you're
Yeah,
comfortable.
safe enough. So can you hear me better?
Yes.
Okay, good. Well, so I agree with what you're saying, and in our office and in the hospital and in the community, we're seeing the same things too. We're seeing people affected from a mental health aspect, and we all have friends and family. We see what's going on in the economy as well. And so I don't want you to think that I also see it through one lens, but I do have some information from the medical viewpoint that I can share. There were a number of articles that have come out, some that Mayor Brown asked me to take a look at, and a couple that I came up with myself. Starting with some good news. This is an article from the NPR, was talking about a study that is going to be coming out soon. They got an early press release, and what it's showing is that they were looking at a particular hospital in New York and comparing patient outcomes from early in the pandemic to patient outcomes now, and what they're finding is a dramatic decrease in mortality among hospitalized patients. So people that are sick enough to get admitted to the hospital, they are far less likely to die now than they were early in the pandemic, and that by a big amount. And so why is that? They think it's partly because treatment is improving. We've learned a lot in this interim time, but also the doctors are getting better at recognizing warning signs. We know what to watch for in terms of inflammation, looking for that cytokine storm that we learned about early on, and watching for signs of increased thrombosis, the blood clots, and knowing what to watch for. Then we can treat people better. It's just an improvement in what we've learned along the way. Also, there's been standardization of treatment and communicating that among people, and that improves outcomes as well, so that we in Kansas learn from the benefit of people in New York who have had a lot more experience with it. The protocols are important. They also say the mask wearing, they think that helps because it decreases the initial dose of virus that a patient receives, and therefore lessens the overall severity of illness for a lot of people. So one of the other things that happens is that we've gotten out of that arena that they were in New York City when their hospitals were at and beyond capacity. Patients are not able to receive their best care when the hospital is at and beyond best capacity. The staff is stressed, their resources are overwhelmed. So since we're no longer in that situation, outcomes have improved, and that makes good sense. The takeaway from this in the article was that it should definitely not be that good, we should throw those masks aside. No, that's part of what's helping. That's one of the prongs that they identified as being responsible for the improvement in hospital outcome. So we shouldn't look at the improvement of hospital outcome and say, yippee, we don't need the mask. No. It's improving only partly, but partly because of widespread mask usage, which is adopted a lot more widespread in urban areas like New York, where this is coming from. So good news. I'm happy to start with some good news. Some of the articles that Mayor Brown sent to me, one was from the Federalist, and it says CDC finds overwhelming majority of people getting coronavirus wore masks. And this is referring to an article in MMWR, which is a publication from the CDC. And what this publication was about was they looked at two groups of people. Both of them were sick, and one group had coronavirus and one group were sick with something else. They tested negative for coronavirus. And the point of the study was to try to figure out, in people that are getting sick, if they have coronavirus, can we identify what is more likely to be causing that? So that, and this is an important study, so that we can then trace that down and make it safer for people. And what they found in this study was that the people who tested positive for coronavirus were more likely to have a close contact who was positive, which makes sense. Also, they found that people that ate at dine-in restaurants or bars and coffee bars did test positive more commonly, and that's one of the behaviors that was associated with positive COVID testing, and that was the result of the study. So this was done, it doesn't say where. I looked through the article and I couldn't find where it was done. It was done in July. And so they also, as part of this, they were talking in the article about okay, who was in the study? And they want to make sure that the two groups, the people that tested with coronavirus and the ones that tested negative, they want to make sure those groups are similar so that we can draw conclusions about the differences. And what they found in there was that the majority of people in the study were wearing masks, and they reported that they wore masks most of the time. Yep, and this makes perfect sense because that's representative of the community. This is, these studies are done in urban areas. They don't do those in McPherson, Kansas. We can't get enough people who have tested positive with coronavirus and to do a study of this size. They're done in big cities, and in the big cities in July, this would have been expected to be representative of the community. There was only a small percentage of the population that was not wearing masks. They reported that they never wore masks, but that was similar between the group that had the coronavirus and that did not have the coronavirus. And so when this study says that that the overwhelming majority of people who get coronavirus wore masks, well, yes, because that's representative of the community. And so another point that I need to bring up is, well, what do masks do? Are they 100% protective? No, and that's the nature of a protective intervention, whether that be mask wearing to prevent coronavirus, or whether it be influenza vaccine to decrease the risk of influenza, or whether that be birth control to decrease the risk of pregnancy. Nothing is 100%. We're decreasing risk, and that's what we do. And so, do we expect it to be 100% protective? By no means. That's been our experience. It decreases the risk of wearing masks, does decrease the risk of contracting coronavirus substantially. And it decreases the amount of viral load that people get if they are to be exposed. And what we're finding is that over time, because of that, we're seeing less severity of illness, as is demonstrated in that article from the NPR from the hospital in New York. So, what I'm saying is this is a very poorly constructed study. The conclusions that that the Federalists drew from this was saying that the masks are not protecting against coronavirus, and that is not at all what this study showed. And they were taking data out of context and skewing the reports. So I'm very unhappy with them. They have not asked my opinion, but there you go. But it was very skewed data. And that was my assessment. And this morning as I was looking at it, that was also the assessment of fact-checking on USA Today. They also said that's bunk. So another article that before I go on, do you guys have any questions about that one?
No.
Okay.
I don't.
Okay. Another article that the mayor sent me was from the New York Times. It says your coronavirus test is positive, maybe it shouldn't be. And it was talking about the tests themselves, and are they so sensitive that they're picking up infections that really shouldn't even be reported. And it gets into the weeds of talking about cycle thresholds and are these tests too sensitive? Is that why we're seeing so many more infections? And so they posed that same question to Dr. Norman, who is the head of the KDHE, and that was addressed in the Topeka Capital Journal article. And he addressed that and said that the cycle threshold is something that is set by the manufacturer of each test. It's kind of and so it's going to be different for each test. Similarly, two different blood pressure medicines, an appropriate starting dose might be 2.5 milligrams on this dose, but on this medicine, but 10 milligrams on that medicine. So, that might be a reasonable analogy, that it might be one cycle threshold for one test and another cycle threshold appropriate for another test. But these cycle thresholds, that just tells us how many times they had to amplify the virus before they took a reading. And at that cycle threshold, was it positive or was it not? And so when a manufacturer is coming up with a new test, they set these parameters and they create their test and they send it to the Food and Drug Administration saying that at so many cycle thresholds, that's where we measured it, and either it's positive or it's not. And so the article here is arguing that, well, maybe the cycle threshold should be lower. Well, the test wasn't studied that way. It wasn't all of the data that manufacturer put into getting it approved was not done at a different cycle threshold. And so we can't just willy-nilly dial it down. And so what is happening, it appears, is that folks are saying that, well, if we made it less sensitive, we would pick up fewer infections. And, well, that's true. However, there's no reason to think that the cycle threshold is the reason for the increase in diagnoses that we're having, because the cycle threshold for each test has been the same ever since they put it out. They've not changed it. So the test that we're using, the send-out test that is our gold standard, typically either goes to KDHE or to Quest, and they have been using the same test to do PCR from the whole through the whole duration. And so our increase in our number of positive tests is not due to changes of the test. So it kind of gets pretty deep in the weeds in the technicality, but I'd have to go back to Dr. Norman's statement. The sensitivity or cycle threshold was set in accordance with both the manufacturer and the Food and Drug Administration guidelines for the test, and that's where that that's where that responsibility lies. And so I don't find that even us in general, everyday practice in the medical field are able to, we're way out of our depth to come and make recommendations in terms of changing the cycle threshold. So I think that second guessing that is something that the general public and the medical community should not do unless we're actively involved in that research. So I don't know if I explained that well.
Yeah,
So did I leave questions?
You did a good job. I
Yeah.
don't have a question. I'd have a comment that these are difficult studies, and they are reported in general media without the ability to get down into the weeds, as you say. And so I appreciate you going back to an original article that was that the media made a comment on to get into the more detail. And what we're really saying here is that nothing has changed from the beginning. When we're getting few tests positive, it's the same threshold as what we're getting and using today.
Right.
So-
The test is not
So
changing.
there is definitely, at different points, even in our experience in the county, there are spikes, and we're going to continue to see some spikes here or there. And we're going to have some continued valleys as we go through. And so I appreciate you taking the time to look up the background.
Perfect. I have just, if there's time, I've got another article that I think is relevant as well. And I should clarify that, we were talking about the test. Yep, the test that we've been using, it's the same test all along. There have been additional tests that have come out that we're using in addition, the rapid tests, but that's not the issue we were addressing. So I just want to make sure that there's clarification on that. Very recently in The Lancet, there is a consensus statement that came out talking about what's the best way to deal with this and kind of addressing the herd immunity approach. And they were looking at putting together data as to why they think that is or is not a good idea. And that is one of the approaches that has been kind of put forth in a lot of the community. And I have friends and family who subscribe to that notion and to that idea and preference. I have colleagues that subscribe to that notion and preference. And the idea behind the herd immunity approach is the notion that that infections are going to continue, and we are and we're not. We would be best to just let infections happen, and then we develop immunity among the whole community, and a lot of us are going to get sick, and some of us are going to die, but then immunity happens in the community, and that is how we get through this. That's the notion behind it. And the folks who subscribe to that are not in favor of any restrictive measures because they think that just prolongs this and keeps people from developing herd immunity. So I hope I'm representing that right. So that's what the point of this article is looking at why, why that may not be the best approach. And I would say I don't think that's the best approach. And the reasons that they gave are these. Firstly, it risks significant morbidity and mortality across the whole population. More people are going to die. And we are already in a situation where we have had difficulty getting our patients transferred to Wichita. It's happened again this week that we had patients that needed higher level of care couldn't get there. I'm not saying those people have died, but I can tell you they did not get the level of care that we wanted for them. And if this continues to happen, it stands to reason that that can impact people's outcomes here where we live. And that's going to get worse if we just don't take precautions and we see a lot more infections. So I see some validity to that. That's in addition to the human cost, that's going to impact the workforce because people are sick and home and business owners can't keep their businesses open. It's going to overwhelm the ability of healthcare systems to provide acute and routine care. People will not be coming in for their mammograms, their well checks, their blood pressure check, their diabetes management, and people would suffer on that front as well. And here's one thing I want you to hear. We don't yet have any evidence that there is lasting protective immunity. So this is data we don't have yet. And I don't know how this is going to shake out. We don't yet know how long people are immune to the virus after they've had an infection, or if that happens for everybody at all. Now, the other argument is, well, when there's a vaccine, will that give lasting immunity? That's part of the information we need from the vaccine makers as we get data and as we're getting closer to having a vaccine to offer. So, important question. I don't know. But that's one of the things that they're going to be keeping an eye on. But we don't know that getting the virus and getting an infection is going to give long-lasting immunity. And if it doesn't protect a person long-term, then what happens with similar illnesses that have only a short-term immunity is that there becomes these recurrent epidemics that go on over and over and over. And so that creates a huge burden on the economy and also on healthcare workers as we're dealing with this perpetually. And thinking about the herd immunity idea also would allow for a lot more infections than we would otherwise have. We have to think, too, about the long-term consequences of coronavirus infection. That we're finding currently, thought is that can happen in up to 30% of people that get coronavirus infections. They have long-standing symptoms that go on for months. And, we're getting more and more data about how often does this happen and to whom and how long does it last. But long-standing shortness of breath, fatigue particularly, and of less importance, some people never regain their sense of smell or taste. That's not as debilitating as the shortness of breath and the fatigue, but nonetheless. So that was the point of this article in The Lancet, was making arguments about why the herd immunity idea is not a good idea. We still hold out hope and expectation that we're going to see immunity from a vaccine. Of what degree, I don't know. How long lasting, I don't know. Those are the kind of things that we're gonna find out as these vaccines get out of trials and into recommendations. And those are solid questions that we all want answers to. But I think they offer the promise of decreasing risk to the population. People would be expected to have fewer infections, and the ones who do get infected would be expected to have less severe infection and much lower death rates, as it is with influenza vaccine. And so That being the case, it's worth holding out for. Do you gentlemen have any other questions for me?
Yeah, you answered one that I was gonna ask is, how long your immunity lasts if you did it, and we still don't know, but the
I don't know.
90-day number is thrown out there a lot in the media, and that may or may not be good, we really don't know, but I think what we are hearing, even if it's a different number than 90 days, is that just because you had it, it doesn't mean you can't get it again.
Very recently, we had our very first death from somebody who had a second infection. So,
Locally,
no,
No?
no, not locally.
okay.
But it's rare, and that's why it made the news. But it just goes to show that reinfection can happen and can be severe enough to cause death. I understand the person that this happened to did have a number of comorbidities, other illnesses, but it does raise the question and does raise the possibility that it does not give lifelong protection, certainly not for everybody.
So if you're infected, and you go along and test negative, and then you all of a sudden get it again, and you check positive, does that, your immune system is not gonna be as good, is it?
You
Or
know,
is it? I guess I'm asking that.
it's a solid question, and I don't think I know the answer
Okay.
to that. You know,
Okay.
how do second infections, how are they handled by your body? And I don't have the answer to that. You know,
Okay.
I certainly would have hoped and expected that it would be milder because, you know, your body has seen at least a coronavirus, even if it's a different strain.
Right.
And surely you would have some immunity, so you would expect it to be a less severe infection. But I don't know that to be fact, and
Okay.
that is still out there. We
Yeah.
don't know yet.
Okay.
We're going
Thank
to know
you.
a lot more before the end of all of this, just in time for us to not care.
I understand.
Unfortunately, we're in the middle, not at the end.
I know.
Yeah.
Yeah, so
Yeah.
that is a problem. On the most recent health department report, where we had 21, and it's not in the graph data that didn't come up, but we are not seeing increase the last few reports on asymptomatic. So I'm assuming that we're just not, maybe we're not even testing asymptomatic people, but from the guidelines we said, but we had of the 21, we had 12 of them were from unknown exposure. So we continue to get more than half of unknown exposure on this, and we had 4 from 50 to 59, 2 from 40 to 49, 30 to 39 is the best place you can be if you're in that age group. You got no increase. And we had 4 from 18 to 29. And then we know that we had an outbreak in the schools. We had many more quarantine than we actually had cases, but we only had 2 increase in that under 18, which is pretty low. And then we continue to have more females than males that seem to get this. So I don't know what the deal is there, but the comment was made in the EOC meeting that a number of these, I don't know what number of these means, came from people that attended weddings or other group gatherings. Is there anything we're seeing there? And, they may not have worn a mask at a wedding. I had a granddaughter get married, and she didn't want anybody to have a mask on at her wedding because the pictures would stink, but there were masks. And then for the picture, for the brief time, they took the masks off to take the picture. But any thought on that? And are we talking about isolated group gatherings versus general public interaction?
Well, my view to that, what I know and what I'm involved with is I'm not as as closely involved in the day-to-day, every case that comes through in McPherson County that's managed by the health department. So I can't necessarily speak to that. What I am seeing and hearing from the KDHE, they're reporting on this, and I'm sitting in on that every week, is that when people do have connections and close contacts, it's now in smaller and smaller groups. Usually because people are not necessarily attending mass gatherings, but they feel pretty comfortable taking off their mask when they have family gatherings with extended family. And I'll tell you, I can understand that. You know, when my extended family comes over, it is weird, and would be weird for us to wear masks. If it's my brother and my mom and my sister and my nieces and nephews. However, the truth of it is they're coming from out of county, sometimes out of state. They're bringing exposures that I don't have, and so by strict KDHE guidelines, should we be wearing masks? Yeah, we should. And they are seeing that the positivity is shifting from mass gatherings, which we're not having anymore, more to smaller gatherings. That is happening more commonly. And really, I wish I had a little more time. I was kind of surprised at the numbers that you had from the Harvard site, because that really surprises me and doesn't fit with what I'm hearing about our local activity. And I know they lag, and they always have lagged, but that seems just really low. That's just my gestalt, but for
Well,
what it's worth.
they are, according to 321 cases, so the only thing that is missing on the Harvard data is the late Monday 21 cases. Everything else is there, and it's been the same all along, just like you say, it's the same all along for our threshold and everything else. It has not changed, so
One thing to note, though, is that the positive cases in McPherson don't wait on the health department to report it to the state. From the lab, if they have a positive, it gets sent from the lab to the state. And so even though we all were late in learning about those 21 cases, the state was not. So
yeah, so the state's probably the one reporting for all the counties.
I would imagine so. I'm not
Yeah,
sure how
but
Harvard
They
puts their
report
data.
to Harvard?
Yeah, and I'm guessing that
That's my guess.
I think so.
tomorrow or the next day, the state will have sent everybody's data again. So that's why the lag just works its way through the system,
Right.
type thing. But I personally don't feel I have a reason to question the Harvard data, because they match up with cases and a number of other things. So I'm feeling like they put it in. There is another piece that has been done, and I sort of said this lightheartedly on Monday, but maybe we ought to test our sewage to find out what it says. And ironically, on September 28th, the state tested our sewage. The report came back late yesterday. It's a 40-page report, so there's no way to use it today, but we do have the virus RNA, and you may explain RNA, in our sewage. So we know we have some presence. Now we have to digest the report to find out what degree of RNA do we have in our sewage. We know we have some cases, but that was thrown out about 60 days ago. Communities could test their sewage and find out. But I said that lightheartedly, not knowing that the state had already run a test, and I don't think we knew it at all as part of what they do. And now we will be able to look at that report and also share it with you, so that we know what our sewage is saying too.
Pretty cool stuff with that. I think it was an Arizona university that they were able to test the sewage from on campus, and they were able to identify positive cases and narrow it down to a dorm, because the sewage coming out of that dorm had a bump in the viral load. That's cool. I'm not all about, collecting sewage samples myself, but that is awesome. When it comes down to being able to really help and identify where these cases are and before, maybe before they're even symptomatic. So yeah, there's some really cool stuff coming out.
Okay, any other questions for Dr. Gorman? Okay, I would like to cover a couple of legal things. There are two different drafts here if we would take an ordinance. The one is basically the same thing as we had before, but it would have a different expiration date if you want an expiration date. The other one is what we could have done before and didn't do to make this a Class C misdemeanor. The Class C misdemeanor is going to take the Class C penalty, which I think is about $88, and then it's going to also include court costs. So anybody that is cited and given a ticket would end up with a $300 to $300+ penalty for this. And all of those cases would have to be tried by the county. Greg Benefield sent me a thing saying, please don't do that. You don't know what you would be creating for me. And I don't want to create that for him. So I'm just saying, so you know the difference. I did have both kinds of things put in here, but that is a problem. So I see it as we have the same options I mentioned before. One, we could continue to exercise simply the Kick COVID campaign. And that is, in many ways, what the ordinance does. And the third point there, we talk about healthy exercise, wash hands frequently, practice good nutrition, social distance, or wear a mask. One or the other. And that's basically what our ordinance said before. And we talked about this, you make the choice. If you can't social distancing, you have to wear a mask. If you go to the grocery store, you probably can't practice social distancing. And if you go to a business that requires a mask, you have a responsibility to honor what that business wants to do. Now, it was reported yesterday by the health department that several businesses closed because they were doing it. I have no report of a business closing. So hopefully we will find out in the next day or two if an actual business closed on this. We could pass one or the other of these ordinances. If we pass one or the other of these ordinances, I still think we would have the Kick COVID campaign. If you were on the meeting yesterday, it was reported that there is maybe more acceptance of the campaign than was originally thought possible. But one of the reasons why there's more acceptance of the campaign is that the big red block that we had right on the poster is, you make the choice. So we're putting it back, taking the onus off of the small business owner and putting it back on the customer. And that's who's going to make the choice anyhow, whether you agree or disagree with whatever we do. So from that standpoint, our results still have come down dramatically. I have a hard time with the counties around us, and being chairman of REAP, I have to deal with some of their counties. When we can't send somebody to another hospital, one, we don't want any more cases to create that situation that we'd have to send somebody. But the fact that we can't send somebody to Wichita is I can't correct their problem. I can't correct Hutchinson problem. And I can't correct if we had somebody to even go to Salina, their problem, because they're all higher than we are. And they all have had a mask ordinance for a long time. I guess my dilemma personally is that we're doing better than most people. Should we do better? I believe it, that's why the campaign, but I'm open to discussion from either of the commissioners on where they would like to go, or do they want to wait a little longer in what we're doing?
Well, I'll say this, that I have wrestled and wrestled and wrestled with this thing, and I'm trying to make a decision based on something. And I've tried to make it on science, but the problem I'm running into, and Sheila's addressed, Dr. Gorman has addressed a lot of this morning, is the parameters they give me problems. I don't understand how that works, some do this, some do that. The type of testing differs. It's impossible for me to make a decision on science. Science just doesn't seem to agree in my simple-minded head. And so I have trouble doing that. The internet is loaded with information. A lot of it's true, a lot of it's false, but you don't know what to believe and what not to believe. This week I got a report that Dr. Gorman addressed this morning about the CDC that find that masks are ineffective in preventing coronavirus spread. So I go to the CDC website, and just in case this is a poor report. CDC website says nothing about that. So the Federalist or whoever is throwing information out there that's probably not totally correct. My inbox on my computer is constantly full of citizens' expectations. Many of those are from internet quote-unquote experts. Some of it has absolutely no credibility as far as I'm concerned. I call it conspiracy theories that are out there that, such and such is going to happen if we do this. So it's all over the place, and my mind is a spider web trying to figure all this out. So basically, for me, it comes down to this. Part of the responsibility of this commission is the health and well-being of this community. I mean, that's part of what we need to do and what we have the power to do, is to do some things in that regard. And so for myself, since I can't make a decision based on science, I can't make a decision based on what anybody else says, I'm just going to sit back and throw this all up in the air, and I'm going to vote, if we vote, to err on the side of caution. And so that's basically where I'm at. Larry, you got anything?
No, I don't disagree with what you're saying when it comes to information, whether it's in the emails, whether it's I don't care where it comes from. You can weigh it one way and you can weigh it the other way. I guess the thing that locally that doesn't have anything to do with the way I would vote, but I am disappointed that the county is not taking a little bit more responsibility when I'm talking about the commissioners are not taking a little more responsibility even from the onset of this whole thing. And consequently, you had to rely on the towns around us. Lynchburg has a mask ordinance in effect right now. I don't know that they've ever lifted it for any reason once they put it in. And I spent some time in Lynchburg last weekend at 4 or 5 different places, and I can honestly say that these people are wearing masks. They're wearing the mask like you walk up to the storefront, and it said mask required, and you walk inside and people have masks on. And I talked to one gentleman, and he said, I do not understand why people don't want to follow the rule. If the rule says wear a mask when you walk into this business, then you need to wear a mask. If you don't want to wear a mask, then don't go into the business. And I'm just, I'm at a point where I'm ready to vote. I'm ready to vote on wearing a mask or not wearing a mask. And the ordinance that I'm interested in is the one that does not have the big fine on it. That's where I'm at.
Okay. Well, I will say where I'm at. I would like to see the data of the 21 cases in before we make a decision. If we are rocking along at these low numbers, as reported by Harvard, taking all our data, then I would like to continue to emphasize the campaign. We had a very difficult time before with police issuing a ticket for this. And if we are not going to move out of a low category, I have a hard time. Do I believe that the masks are beneficial? I personally believe they're beneficial. It doesn't matter whether they stop the smallest particle of this particular virus or not. Our point has already been made. They will decrease risk and they will decrease the viral load. And those are two important factors that have to be considered. But we are going to still be better as a community if we're staying low and outperforming everybody around us, if these can be personal decisions and not mandated. So that's where I'm coming from. I would like to see, I was hoping it would be there this morning on the 21 cases, but I would like to wait for that to do, and if we have anything else to do it. But if they impact us dramatically, which if in my own statistical mind, I don't see it changing that much, so I hate to mandate something when we're going to show good results, but not perfect results. So that's where I'm coming from, but if either of you want to make a motion, you can make a motion.
Just a quick question, how do you justify this then?
I cannot figure out that 21, and I have a little bit of frustration, and I've expressed this to Dr. Gorman, who's the medical officer for the health department, we need better reporting, because these weren't all done and all of a sudden dropped in our lap at one time. Where did they accumulate from? And if we've gone from reporting 5 days a week to 3 days a week, but we got to be sure we put a report out. We didn't have anything for 5 days, and now all of a sudden we had 21. They weren't all done at the same time. So I want to see that, even if I would rather not have all that analysis of the different groups, to just be able to tell me on Friday I had X cases, not wait till a week later and tell me I have accumulation. So that's where I'm coming from. I cannot get around the positivity rate. And we had second highest, I think, if not the highest number of tests, and that we had a high positivity rate, but we also seen it go up almost to 12 and then back down rapidly again too. So all I'm saying is, once you put a mandate, there are people that won't shop here. We're moving into the biggest retail season of the year, and I gave the 4 items: physical health, behavioral health, economic vitality, community unity. And if it is put us in a situation that's bad enough, then I think we should move to a mask ordinance. But right now, I don't see the data is totally there to do it. That's where I'm coming from. I hope I didn't take too long to answer your question.
Do you know when that data's coming in on Harvard?
It comes in every day, and it is supposedly updated at 11 p.m.
I checked it as of
Yeah.
8 o'clock this morning. and
Yeah,
it
we
wasn't on yet.
checked it, but the Monday, late Monday data is not there. So what I don't know is when we do something and we send it to the state, I don't know when the state releases the data. And I'm assuming that they are not getting emails from every county. There's thousands of counties in the state. I think the state is releasing the data. So but part of the time lag is waiting for KDHE to send the data. We are at, on Monday, we were not at 321, I forget what the number was, but now today we were at 321. So the only thing we're missing is the late Monday report of 21 cases, and we're still low in the yellow. So that's where I'm coming from.
Okay.
But I'm open to a motion.
I move that we put a draft ordinance in place with an effective date on it of the 23rd of this month to the 23rd of November. And the draft ordinance would not have the fine in it, whichever one that is.
Yeah, you want the original?
I want the
ordinance that
original
we
draft
had- The
ordinance.
ordinance we had before with the $10 fine.
That's correct.
Yeah, okay.
Do you have are you projecting an end date to this too?
Yeah, he
I
gave
did,
it.
23rd of November.
Okay.
That's on a Monday. That's a commission meeting Monday before Thanksgiving.
Okay. Is there a second? Okay, the motion dies for lack of a second, and does anybody want to make another motion? Okay, we will continue to monitor this, and if we move out of the yellow, we will bring it back up for a mask ordinance, and at that point, there won't be any question. Okay, thank you. Okay, I'd like to move on to the Spark funding.
Last week in study session, I brought to you the municipal court office expansion with Spark funding due to the COVID pandemic, and showed you the pictures of the current space and then the space that we are looking at expanding to. We did receive the second quote finally. Boats Construction out of Newton submitted a bid. And after reviewing the bids, the lowest bid is from Hutton Construction at $21,400, and so we are recommending moving forward with Hutton to complete this project with the stipulation that it needs to be done by December 30th of 2020.
I would like to move to approve the bid from Hutton Construction to complete the municipal court office expansion project as part of the Spark funding for an amount not to exceed $21,400, and for the work to be completed no later than December 30th, 2020.
I'll second that.
All those in favor say aye.
Aye.
Okay, we're down to the Kansas Eviction Prevention Program. Went ahead and asked Nick to cover this because it's an important thing, and while there are some people still having trouble with paying their mortgage or paying their lease, we need to know for sure exactly what's going on with this. And so you want to give an overview of KEPP program.
Yes, one of the challenges they had is after a certain amount of time, there was a governor's order that basically said that folks couldn't charge that if folks couldn't pay their rent as a result of any impact from COVID, whether it's job loss or an inability to go to work, that there were some protections early on during the COVID pandemic. And what's happened since then, since those have dropped off, is we've got issues now where people are starting to be impacted directly by some of these evictions. And what the state and what Kansas Housing Resource Corporation, in conjunction with the governor's office and a number of other partners, have said we have some federal funds that are available, and let's make those available in the form of a grant up to $5,000. And what the way it works is the Kansas, basically the CAP program was what they're calling it, is the Kansas Eviction Prevention Program. It gives landlords and tenants the ability to apply directly through KHRC for that $5,000 to pay delinquent rent payments dating all the way back to April 1st of 2020. The payments can be made directly to the landlord but the landlord has to agree to not evict any of the folks in the household during the period of which they're receiving funds, or so going back. So say a landlord's been kind enough to not evict somebody for a certain period of time, they can actually go back and get grant funds to pay for what that rent would have otherwise been. And so, we were contacted by the director of KHRC that asked us if we personally put the information out on this. I've shared it with the McPherson Housing Coalition. We've shared it with United Way. We've shared it with the Community Foundation to hopefully get the word out on this. But today is about kind of trying to put the information out on this. I know we put it out on social media. We put it out on the website. And what we're encouraging people to do, since they do apply directly through KHRC, is we're trying to get people to go to the KHRC website. And actually, if you go to the link for this meeting, you can actually go onto their website and look up the Kansas Eviction Prevention Program on the Kansas Housing Resource Corporation website. And there's a couple things you can find. They have some guidance. There's two parts to this. A landlord has to complete a portion of it, and the tenant has to complete a portion of this. If you go to our either on this link or to the KHRC website, you can see these things. They've got a video. It's 2 short videos that you can look at to address that, that walks you through the steps you have to do. But there has to be some agreement to the landlord and to the tenant to complete these sections of it. And there has to be some agreement that there's some terms and things that you'll have to follow. There's some certifications that are tied with it. But if you like our like our Facebook site or some of our social media, or if you go to our website, you can see direct links to where you can find this information. But I think it's pretty critical if there are folks in McPherson community or really anywhere that want to take advantage of this. The deadline for this is, I think, November 30th. Is that what we determined? If you're going to do this, you need to think about getting it in right away. There's only going to be a limited amount of funds that are available for this, and so if you have a situation where you've got a tenant unable to pay and they can verify that it's related to coronavirus, that they've been laid off or anything of that nature, I'd encourage you to really take advantage of this. The funds will only be available for a short time frame, and if there's folks in our community that can do that, I would encourage you to do so.
Okay, and I will present this at the Chamber Board meeting tomorrow as well. So we're trying to cover the community as much as we can. And like Nick said, if you're in this situation, get the application, get it sent in. Whether you're a landlord or a tenant, let's go after it. And we've been really good in the past for different grants of different natures involving coronavirus, but we have been active in trying to get what we want, and we've done a good job. So this is an important thing to just help people keep on keeping on until we get farther down the road on this. We will. I think I would like for Sydney to continue to promote the Kick COVID campaign, which we're getting a fairly decent response on, which she said yesterday was surprising. I told her she was a person of little faith. But the one thing I'd like to do a little bit different in the promotion is talk about that this will decrease risk and decrease the viral load. It doesn't matter whether it's social distancing or mask, both are capable of doing those two things. So let's run a new round out there with the poster and those two items to try to lower this down.
Good idea.
And I would like to say that just because a motion failed today does not believe that all three of us, besides being confused with different data, all of us believe there is value in a mask. And if you can't wear a mask, social distance, protect yourself, and all the things that you can do to get this behind us. Yes, the death rate is very small, but my personal feeling is one person dying in the community is more than we need to have if we can prevent it. You know, so we are in unity that if this is going to continue on and we may have to live with it, and then I need the citizens, if that ever happens, to not hold it against any business, but still do business with them. You can go in and go out. I realize grocery shopping is the one long-term deal. But, and we did check into whether there are more viral things, as some internet articles have said from wearing a mask, that you can get pneumonia or these other type of things, and it didn't come up with anything of clinical data that supports the articles that are written that way. So I've done everything I can. I have sent not a message well enough understood, I guess, but any doctor that has a different viewpoint or isn't being called is welcome to come to this meeting and give us input. So I will try to see if there is not a doctor that hasn't been here that would be willing to come on Monday morning to get in and out of here at the very beginning of the meeting and give us their perspective if they have a different perspective from what has been reported. So with that, is there any other business for today? Okay, I'd like to move that we adjourn this special city commission meeting.
I second.
All those in favor say aye.
Aye.